Good morning, this is Oakley. This is my demonstration speech. I'm going to be demonstrating how to give an intramuscular injection. So sometimes life isn't fair. I'm sure there have been times in each of your lives that you've had some sort of health issue that needed a shot. Whether it's a really bad allergies, some sort of infection, or a deficiency, you or someone close to you may one day need a medication administered by intramuscular injection. For the last 5 years, I've been a medical assistant. Part of my job is giving shots, whether it's a vaccination or medication. In this demonstration, I'm going to guide you through the proper steps of giving an intramuscular injection as a healthcare worker. Let's begin. Steroids, hormones, vaccines, and antibiotics are common medications given via intramuscular injection. Common sites to give an intramuscular injection are the upper arm, buttocks, hip, and thigh. The first step will be to gather your supplies. You will need your order, your medication, in this case sterile water, a properly gauged needle, syringe, Band-Aid, gauze, alcohol wipes, and gloves. After you've assembled your items, you'll want to attach your needle to the syringe. Verify the correct medication from your order and draw up the medication. If your medication is a multi-use vial, you want to wipe the top of the vial to make sure it's clean, and then draw up the same amount of air into your syringe as the amount ordered on the dosage. And then you'll insert the air upside down and draw up the medication. This will make it easier to draw. And then make sure to remove the air bubbles. Once you've got everything together, you can enter the patient's room. Sanitize or wash your hands. And then greet the patient to inform them of the doctor's orders. Hi Carol, I'm Oakley. I'll be giving you 1 ml of sterile water. And then let them know which medication is being given and where it will be administered. Going to administer it in your deltoid. Make sure to have the patient sign a consent before the procedure. And then organize your workspace so that it is a smooth process. I like to take the cap off the needle so that way and then leave the needle inside so that way it is a smooth process. For a deltoid injection, have the patient sit or stand with their arms relaxed at their sides. For a dorsogluteal injection, have the patient stand and lower their pants to expose just the upper part of their buttocks. For the ventrogluteal, have the patient lie on their side with their pants lowered to expose their hip. And for the vastus lateralis muscle, have the patient sit and lower their pants or pull up their leg sleeve to expose the thigh. Now you are ready to begin to give the injection. Usually I stick the Band-Aid, one end of the Band-Aid on my glove to make it for ease of access, and then identify where you'll be giving the medication. For the deltoid, can you hold that, your sleeve up? For the deltoid, you'll feel the bone at the top of the arm. 2 fingers below is where the deltoid is. It's a triangular muscle, and you'll want to go right in the middle of it. For the deltoid can only hold 1 ml of fluid. For the dorsal gluteal muscle, it's on the buttocks. So you'll lower the pants and you'll divide the butt cheek into 4 quadrants. It's the outer quadrant. For the ventrogluteal muscle, it's on the hip, and so you'll find the hip bone, and then with your thumb towards the groin, you'll make a V shaped with your fingers and go right in between there. If I'm giving a ventrogluteal injection, usually I'll leave the alcohol swipe on the site as a marker. And then for the vastus lateralis, you'll divide the thigh into 3 separate areas, and it'll be the middle area. And then you'll sterilize the site for the injection. Make sure not to touch the area again, or you'll have to squeeze it a second time. Let's see, I'm gonna detach this just for. So then squeeze the muscle with your non-dominant hand, and at a 90-degree angle, you'll insert the needle and with your thumb, inject. As you remove the needle, make sure you activate the safety. So, like that. And then use the gauze to wipe away any blood or fluid. Then you can place your Band-Aid. If you're having trouble seeing where you gave the injection, you can squeeze a little bit so a little dot of blood comes out. And then dispose of the needle properly in the sharps container. Oops. If you're using a pre-filled syringe, detach the needle and keep it for documentation purposes. Remind the patient the injection site might be sore for a couple days, but to keep an eye out for abnormal symptoms like severe pain, redness or swelling, or signs of an allergic reaction. And that's all there is to it. Injections take a lot of practice, but once you learn how to administer it, will become like second nature. One thing that helped me when I first started giving injections is remembering that the shot is necessary to improve the person's health. Now that you're familiar with intramuscular injections, you can understand the process next time you get a shot. You might even be inspired to join the healthcare field. And I'd like to thank Ms. Carolyn for helping.